Autism quietly shapes how a child connects, speaks, and understands the world, yet many don't recognize it until much later. Hi everyone, welcome back to Reem Healthcast. Today we're diving into the complexities of autism, from its history to its modern-day understanding. Autism is something we hear about a lot, but the nuances of it, the spectrum, the causes, the treatments, are often misunderstood. Where do you think we should begin?
Let's start simple. Autism isn't a disease, it's a neurodevelopmental difference. That means it influences how the brain develops and how a person communicates, connects socially, and responds to the world around them. It's most often recognized in childhood, but it can be diagnosed at any age. And what's worth keeping in mind is that there isn't one single cause, and it can look very different from one person to another.
That's what makes it a spectrum, right?
Yes, and that's why the word spectrum really matters. It reminds us that autism doesn't show up the same way in everyone. One child might avoid eye contact. Another might take longer to develop speech. Some may become deeply absorbed in a specific interest. Others might feel overwhelmed by certain sounds, textures, or even small changes in routine. There isn't one single look to autism. It's unique to each individual.
So, where did the term autism actually come from?
Well, the term autism was first used by the psychiatrist Leo Kanner. He noted similar patterns among 10 children who had common features like delay in language, nonverbal communication, increased sensitivity towards changes in their routine, in interacting with others, and difficulty in interpreting social cues. And around the same time, another physician was making similar observations. Hans Asperger, an Austrian pediatrician, described a group of children who also struggled socially, preferred strict routines, and had very focused interests. But he noticed something different about them. Many of these children had strong language skills, excellent memory, and often above-average intelligence. Unlike the children Leo Kanner described, they did not show significant language delays. Their challenges were more subtle. Difficulty with social communication and understanding social cues, despite having advanced vocabulary and intellectual strengths. For many years, this presentation became known as Asperger's syndrome. It was seen as a distinct form within the broader autism picture, helping shape the idea that autism exists on a spectrum, with different patterns and varying strengths and challenges.
What I find so compelling is how diverse the symptoms can be. So, what are the symptoms of autism?
For some children, you might notice they avoid eye contact, or seem less interested in interacting physically with others. They may struggle to understand facial expressions, gestures, or even tone of voice, which makes social situations confusing. Speech can also be affected. Some children experience delayed language development, and when they do speak, it might sound sing-song, unusually flat, or even a bit robotic. You might also see very focused interests, sometimes becoming deeply absorbed in just one or two specific topics. Repetitive behaviors are common too, like repeating words or phrases, or movements such as rocking back and forth.
That really helps paint the picture. What other signs might parents or caregivers notice?
Beyond communication and behavior, many children are also sensitive to sensory input. Sounds or physical touch that feel completely normal to others can feel overwhelming to them. And even small changes in daily routine can be distressing. In some cases, seizures may occur, often starting during adolescence. It's important to know that seizures don't always mean shaking. The most common type linked to autism is called absent seizures, where a child may briefly lose awareness for a few seconds, almost like they're staring off without realizing it happened. And again, not every child will have all of these. That's why we call it a spectrum, because the experience is truly unique for each individual.
Beyond these signs, are there other challenges that sometimes come along with autism?
Yes, some individuals on the spectrum may also experience higher rates of anxiety or depression compared to the general population. In addition, other conditions, like ADHD, can sometimes occur alongside autism. When these challenges overlap, they can affect daily life, whether that's at school, at work, or in social settings. It's not just about communication or behavior, it's about how all these factors together can influence someone's overall well-being and functioning.
So that brings us to the big question. What actually causes autism, or at least what do we understand about it today?
When we talk about what causes autism, the honest answer is there isn't just one cause. Autism spectrum disorder doesn't develop because of a single factor. Instead, it seems to be influenced by a combination of things. Genetics play a strong role. In some children, there may be genetic variations or mutations that affect how the brain grows and how brain cells communicate with each other. These changes can influence how certain traits and symptoms develop. Environmental factors may also contribute. Things like complications during pregnancy, certain medications, or exposure to toxins have been linked to an increased risk in some cases. And then there's the emotional aspect. Early emotional connection, especially between a mother and child during the first year of life, may also play a role. Difficulties in bonding or emotional deprivation in early childhood have been associated with the development of autism-related symptoms. So again, it's not one single explanation. It's likely a combination of influences coming together in complex ways that researchers are still working to fully understand.
So, are there certain children who might be more at risk than others?
Exactly. And there are some known risk factors too. Boys are more likely to be diagnosed than girls, for instance. And if there's a family history of autism or related conditions, the risk increases. Premature birth is another factor that can raise the likelihood.
When it comes to diagnosis, if a parent is concerned, what are the first steps toward getting a diagnosis?
It's a pretty comprehensive process. It starts with a clinical evaluation and a detailed history, followed by developmental screenings. For kids, specialists like neuropediatricians or speech-language pathologists often get involved. And for adults, the process is a bit different. It involves in-person interactions, observations, and a review of past social communication and behavior issues. It's never too late to get a diagnosis, but early intervention can make a world of difference.
Speaking of intervention, let's dive into treatment.
Well, there's no one-size-fits-all approach here either. It's a team effort involving pediatric neurologists, therapists, family members, and even schools. The goal is to help the individual communicate better, interact socially, and adapt to their environment.
So how does each person involved, from parents to specialists to schools, contribute to the treatment journey?
Parents and caregivers truly are at the heart of this journey. Their role goes far beyond simply attending appointments. It starts with understanding their child's unique symptoms, because recognizing those signs early allows for timely support and intervention. Creating an environment filled with support, empowerment, and love makes a real difference in how a child feels safe and understood. Parents also become experts in their own child, learning their strengths, their sensitivities, and their specific needs. This insight helps doctors and therapists design a treatment plan that's truly individualized and meaningful.
What practical tips can help parents navigate this journey more confidently?
Following medical advice, therapy plans, and medications, when prescribed, is another important part of the process. But beyond that, it's about learning how to connect, how to communicate in ways that work for their child, how to be sensitive to sensory needs, and how to build a relationship that feels supportive rather than frustrating. And just as importantly, parents need to recognize when they themselves need support. Caring for a child with autism can feel overwhelming at times, and seeking help is not a weakness. It's part of responsible caregiving.
Now, alongside the family, can you walk us through how each specialist contributes to the child's progress?
First, the pediatric neurologists. They play a foundational role. They focus on correctly identifying what's going on, carefully evaluating the child, understanding the symptoms, and making sure nothing else neurological is contributing to those behaviors. From there, they help create a personalized treatment plan, because no two children are the same, and the approach has to reflect that. They also play a supportive role for the family, counseling parents, helping them understand the diagnosis, answering questions, and guiding them through next steps is a big part of what they do. And when necessary, they may prescribe medications. These can help manage symptoms like irritability, aggression, repetitive behaviors, hyperactivity, anxiety, or depression, especially when those symptoms are interfering with the child's daily life.
And what about the therapists?
Speech therapy helps with communication skills, Occupational therapy focuses on life skills and motor coordination, and physical therapy improves movement and balance. Psychological counseling can address behavioral and emotional challenges.
So where does education fit into the bigger picture of care?
Schools are part of the equation too. For some children, a traditional classroom works well with the right support in place. But for others, a specialized school setting can make a real difference.
And what about prevention? Is autism something that can actually be prevented?
That's a question many parents ask, and the honest answer is, there's no guaranteed way to prevent autism, but there are meaningful steps that can support healthy development and possibly reduce certain risks. It really starts during pregnancy. Good prenatal care matters. Regular checkups help monitor the baby's growth and identify any concerns early. Eating a healthy, balanced diet, rich in vitamins, vegetables, and fiber, supports overall fetal development. And of course, avoiding smoking, alcohol, and drugs is essential. Vaccinations are also important. For instance, receiving the rubella vaccine before pregnancy helps prevent rubella infection, which has been linked to developmental complications. After birth, a child's environment plays a powerful role. Growing up in a supportive, emotionally nurturing, and stimulating home helps lay the foundation for healthy emotional and social development. The bond between parent and child, especially in the first year of life, is particularly important. That emotional connection supports a child's sense of security and social growth. And finally, regular developmental monitoring is key. Early screenings by a pediatric neurologist or developmental specialist can identify delays early. And when support begins early, outcomes are often much more positive.
Are there specific dietary changes that can help children on the spectrum?
Diet can also play a role, especially for children with autism. Keeping a consistent schedule for meals and activities can reduce anxiety. Introducing new foods slowly and involving the child in meal preparation can also help.
Couldn't agree more. I think the key takeaway here is that autism is a spectrum, and every individual on that spectrum deserves understanding, support, and the opportunity to thrive. That's a great note to end on. A big thank you to our listeners for tuning in. Stay tuned for our next episode, where we'll continue bringing you practical, easy-to-understand health topics. Until then, take care and stay healthy.